So hello once again. Thanks a lot for tuning in. This is Steve Taylor. I'm the lead advisor over at Merited Wealth, and you are listening to our Do It For Yourself podcast. If this is your first time listening, we really appreciate it. And, the format of our podcast is really to bring on really interesting people out there that are either starting, growing their business, changing a career, really going down any path where they're trying to leave their mark and do something different out there, and kind of just discuss with them some of the challenges, some of the struggles, some of the successes, the ups and downs of kind of being doing it for yourself. So today I think it's I'm really looking forward to this discussion. I think it's a really really interesting business, real interesting person that hopefully I think any of you listening here will get a lot to learn from her. But I'll let her introduce herself and tell us a little bit about her business, and then we'll start in. So Christine, if you can, let the listeners know about you and your business.
Yeah, thanks, Steve. Thanks so much for choosing to highlight my story. I hope that it fulfills your criteria of being an interesting one. By no means was it a straight path, as I'm sure that's the case with most of the entrepreneurs and business owners that you speak with. Today, I'm the CEO and co-founder of Caribou. We're a software actually that works with financial advisors just like yourself. But once upon a time, I wanted to be a doctor. I never thought that I would work in financial services, actually. I went to school and studied really, really hard, thinking that I wanted to work within the healthcare system. But what I quickly learned was that I wanted to change the healthcare system. And it's hard to do that as an N of one, as a doctor, when you're inside the constraints or framework that the system has imposed. So much to my parents' chagrin, I ended up actually not pursuing my master's degree that I got into a really good school to do neuroscience and physiology and then pursue medicine. I joined a startup, a health tech startup. They were a medical device company. And I just fell in love with technology and being on the innovation side of healthcare. And what I learned through that experience, and another one that followed also in the digital health space, was that there's a misalignment in the industry when it comes to the financial component of care. There's no stakeholder like payers or providers that really care about Americans and helping them save money on their healthcare costs. So that's how I ended up in financial services. It was through a lot of just speaking to people and understanding who they go to, who they turn to for decisions related to long-term care or Medicare, or when you retire and you're scared about your healthcare costs. And that's how I got led eventually to financial advisors, started speaking to them a lot, and learned that planning for healthcare costs is a really big gap in their overall financial planning process. And so here we are today.
That's great, Christine. I love it. What you're saying about your parents and their expectations. I always joke with my wife is that she got engaged to a lawyer and then married a financial advisor, right? That by the time we went to get married, I was out on my own. I'm like, ta-da, here's we're gonna do something totally different. And
surprise.
Yeah, she's been riding this road ever since, and I'm sure your parents are learning about that also. So that's great. That's really interesting. I really appreciate that color on your background, and that really gives a new perspective on how you got into this and what you're doing. So when we met and when we talked and I learned about this tremendous service that you offer, it's really interesting. I found it really interesting in that this is a very, healthcare costs, health insurance, all this. This is a huge industry with so many people doing it, in so many certain ways for so many years. But yet you decided and you said, hey, listen, this is broken. There are gaps, within this. I want to go and do something different, right? And to really where I see where this value is. So maybe, going back to when you were going down the road as the doctor and how you got into this side of the business, what made you or your partners or anybody kind of think that, hey, listen, this is such a big industry, so many people doing it, we can do it differently and we can really bring some different value to this?
I'll first start by saying there was no light bulb moment. I think there really rarely is, as you can tell by the path that we went down. But what was true to the mission and the core of the business from day one is we wanted to put consumers at the forefront. Like, they are our priority. The people who are interacting with the healthcare system, whether it's a simple check-in or whether you're sick, managing a chronic condition, accessing services all the time, that's who our priority was. And so we built our company, before it was even a company, when it was just like an idea on a napkin, and the company has pivoted and evolved into multiple business concepts before we landed actually, where we are today. That was our core mission, was that we're going to peel back the curtain and make sure that they understand any incentive, or they understand what options are being presented to them as a core product. Now, what that meant over the iteration phases of our business was, maybe we were going to help people get to MD Anderson for less money, let's say, if they needed to access, premium care for something. Or maybe we wanted to help them from an advocacy standpoint, be healthier, or coaching, things like that, to be able to save money. What it ultimately transitioned into was healthcare decision-making specific to your insurance, and tapping into cost savings in areas that you might not think that you have access to, like your drug costs. Are there coupons? Can you fill your prescriptions via mail order pharmacy? Can you switch to a generic version of your drug, for example? Those are things that your doctor won't tell you, or your insurance company won't really tell you. Tax savings, for example, might not be a major focus of financial advisors or CPAs. Those are things that we're bringing to the forefront. So more and more, our incentive structure, the core of our business, was really built around slashing any other incentive from anyone in the system, whether it's a health insurance company, a medical provider, brokers who are incentivized to, maybe sell you a policy that's in their best interests over yours because it might pay them more. That was really what we wanted to do more than anything. And the product itself evolved from that.
That's really interesting, Christine. I see the story is so common with entrepreneurs that when they start a business, that it morphs and it migrates into a different type of business. So as I believe you guys, and maybe you'll correct me if I'm wrong, I believe you guys have done a round of funding, maybe multiple, whatever it might be. And so you say what you started in and what you've become now are something, dramatically different. Is that something that was pushed forward by the founders and what you guys were learning through your experience? Or when the investors were coming in, they said, hey, we like your idea, but we think it might be better this way? I mean, how was that kind of that partnership, or that evolution of your business model? How did that go through those early phases?
Yeah, that's a really important question. And we've actually been asked that by our customers, financial advisors. So I'm not surprised that you ask it, because they're interested in knowing whether or not our business direction will shift based on who our investors are. They want to make sure that we're a good solution for them and for their clients, and that we can build a long-term partnership. We didn't raise a single dollar from venture capitalists until we had this current business concept. And I think that was very advantageous for us. And that's where some startups unfortunately fail, is they raise a lot of money with just an idea without having proven it out at all. And although you can pivot afterwards, once you start spending money and when you have money at your disposal, your thought process is just so different. You're not scrappy, you're not gritty, you're not trying to do things like hunting people down on LinkedIn. Instead you hire a marketing manager, you run ads, you do things that are a bit more scalable. But we spent so much time in the non-scalable mode that we developed this muscle of, we better be damn sure that this is something that is going to work if we're going to then go and raise money. So we didn't raise anything. We've raised about $4 million to date now in a couple different kind of, financing rounds. None of that came in until we were certain on the path of financial advisors, selling them software to be able to predict and optimize their clients' healthcare costs, help with insurance decision-making. And although the product itself wasn't built, we had validated the need by speaking to hundreds of advisors. We had a very low tech, form that clients would fill out. And then we would basically, in spreadsheets, conduct an analysis and narrow down plan options and send it back over PDF. Like, that was the way that we validated our product. It took no capital, but just our own time. And that, I think, was a huge, in retrospect, it was a huge advantage to us at the time. I think I had wished every day that I had money to be able to put towards validating the product quicker, speaking to more people, or hiring more team members. But it really did set us up for success.
Yeah, Christine, I think that's a really, really important point. That where you're talking there, that you're really, going through, and when I met with you, it was very clear. You guys really, you understood what this need was. You understood the problem that was out there, and it's important, that you point out that you did that before you went and got the funding. I think a lot of people, like you mentioned, entrepreneurs, when they want to go funding, for the really savvy, investors that are not just family, that are looking there to help you out, which is great, right? Which is wonderful. How many of us get started, but they're not really the seasoned one. They're like, hey, listen, I don't want you to be out there using my money still trying to prove your concept, right? That you really haven't gone through all those iterations of what it looked like and really done, your research on it. It was a great experience. My wife and I had a business many years ago that ended up getting on the show Shark Tank, and we really did. We went really slow, and we researched all the iterations of it before we took anybody's money. We actually never took anybody's money, which in retrospect I think was a really big mistake. But I was stubborn. That's what I learned. But that was a great point. So now you guys have you've grown up. You've continued to work, and your early day cultures. I feel it. I see it in you, right? Like that. Hey, listen, let's get this done. What's happening? What are we doing? How has, since those early days when you're out there really just trying to figure it out, struggling, whereas now you're kind of a more mature, you have a really good concept, you have a really good solution. How has it been, the last few, whatever this time period is since then, and how has it changed from the early days?
Well, I don't know if you're familiar with one of the cultures at Amazon. Every day is day one. So that's carried through, I think, in our entire team unintentionally. I only just recently discovered one of those cultures of the company because I'm reading his book. But that's very much true at Caribou as well, that every day, we're putting the customer first. We're learning from the customer. We know no better. We're not financial advisors ourselves, nor are we, for the most part. I mean, we do have a couple team members who are near it, but most of us aren't near retirement. So if we're really going to build a product that is helping people make smart decisions as their healthcare costs increase, as they're nearing into retirement, where healthcare becomes one of their top 3 expenses, we need to be learning from our customers every single day. And you can't do that well in a scalable fashion. Like, I hate surveys, or I hate, fill out this, scoring chart of what's most important to you. You got to get on the phone with them. You've got to speak to them. You've got to understand what is most valuable to them. And the hard thing is that we have 2 customers, the financial advisor as well as their client. So it's a lot of our time, but it's very well spent. And that's one of the things that we're still doing, every single day. And I think that that's what really, really sets us apart. We were able to have a different business model than a traditional broker. And to just provide a little bit of background there, we don't make any commission for any health plan selection that the client makes. We did this intentionally because we didn't want to provide any biased or subjective guidance to clients. We wanted it to be truly objective. Had we not have listened to the financial advisor and the industry that said, we're transitioning to fixed fees, we're doing subscription models, we're doing more planning focus, we want more comprehensive offerings, we want to get in front of our clients as much as we can. Had we not listened to those sort of stuff, we would have said, oh, if we want to build a business and make money, we'll just make commission, because that could be a lot more lucrative for us. It's a proven model. We'll just do what brokers do. But we really were understanding what the customer wanted, needed. The clients were telling us, they didn't know who to trust. So that's where all of this came from. Again, it was no light bulb moment. So that's really, really core to our company today.
Yeah, that's really interesting. That's wonderful, that you hit at the heart of really in my business, our financial advisor business, this idea of commissions versus fee base and ongoing revenue, right? There's no wrong way to do it, right? But there's this whole unholy war of which is the right way to do it. And yeah, I've always felt, I come from the legal background, kind of that ongoing being on the same side with them. That's really the best way to get compensated, right? Because you're in the same side with them. So as you said, you guys are kind of unique, and I think a lot of companies in our industry are that. Yes, they service us, maybe us, the financial advisor or the client, but they have interaction with our end client. As you were learning this, right, and you were learning that we don't want to be so transactional, we want to be more consultative. Would you say that came more from the end client or from the advisor? Did you have to bring that back to the advisor, do this differently, or vice versa? Who was kind of the one that you would say, like, which party was giving that feedback, or maybe it was both of them to say that this is the way we want to charge and do the business?
Yeah. And I mentioned this before we started recording that I scratched my eye yesterday. So I'm tearing up. I promise I'm not getting super emotional about the business. It's just because my eye is acting up.
It's okay. It's all right to be passionate about your business.
Yeah. These aren't the things that make me cry about the business. Things that make me cry are like doing our taxes and HR and payroll.
Right, right. Oh, payroll. Absolutely.
It was really probably a combination of both. And that's where you really have to see in between the lines, right? Like, it's the classic Henry Ford saying of, if you would have asked people what they wanted, they would have said faster horses, right? But what they were really saying was they wanted to get to point A to point B quicker. The method of doing so was left up for interpretation. It was left up for people to really read between the lines and see ways to make that happen. So what we were hearing was that clients wanted to go to their financial advisors with these questions. Financial advisors didn't want to learn about healthcare. They didn't want to learn about Medicare Parts A, B, D, Plan G, all of that. They did not want to become the experts in healthcare, but they didn't want to lose the opportunity to deliver their clients value in the case or the circumstance that they did come to them with those questions. And furthermore, they recognize how big of an expense it is and how important milestones like retirement or Medicare eligibility, or even the sad ones like divorce or being widowed, are tied to your health insurance and your healthcare cost. So that's where traditionally they've been able to maybe refer out to a broker. But now, because of technology, all of the great platforms that are becoming available in areas like tax planning or estate planning, they've started to get a sense that, hey, maybe I can at least become a generalist, have someone powering the back engine of this and being seen as the hero in my client's eyes. But again, the way in which they would do that was left up for someone to kind of figure out. So I have a sales background. The best thing you can do is ask people questions, even when you're trying to sell them something. And that's what we spent like the first year doing, was just asking so many questions. A lot of them were really silly, stupid questions. And sometimes advisors would say stuff to me and I would nod, and then I would be Googling it and like pretend like I knew some financial concept or things like that. Like, you really have to be willing to put yourself out there and look like an idiot if you're going to do this. And I definitely did. My co-founder and I both, we really, really did. But it served us because we asked all the stupid questions early on. We learned everything that we could, and we just filled in the gaps along the way. And if you have that mentality of just constant iteration, you just keep getting better.
Yeah, I love that. That's really, I got a great technique for you, right? We're kind of all past it, but when early on in my career, people would ask these questions, and I would find I was so eager to show what I knew, I'd give an answer, and then I'd have to go back and research it, and like, oh, that was the wrong answer, right? So my technique was, hey, that's a really good question. I think I have the answer for you, but let me just research it, double check, and get back to you. And it kind of works that, right? So you don't have to go back on what was said before. It's a really great technique for anyone out there, thinking about that. So, really what you guys are, Christine, and so much in the business, really in every business nowadays, it's outsourcing a certain competency, right? To say, I don't want to become the expert on it. I have other partners that can kind of, do that for me, and the like. And so you guys, what you've become, right? It seems like as you said, you guys are a platform. And can you explain a little bit about why it's a platform, why when you're kind of outsourcing, you're looking for another partner, the importance of a platform, right? A tech interface rather than somebody that you just call on the phone, and why that's, really important for the people that you're working with and also for your future, business success?
Yeah, I'll answer in that order. So for the people we're working with, workflow is really important, right? And being involved in the process, getting the insights, getting the feedback back loop, seeing how it impacts the client and their financial plan, that's really important. And so that's where the platform comes into play, to be able to give a seamless interface to both the financial advisor, to the client, to not only input data, but then also to get and receive the results back and the analysis, the numbers, the graphs. Healthcare is really complicated. And so transforming it into a language that is digestible, easy to understand, guides the client, all of that is really important. And the workflow of that is really important. The most common objective I think that we get from advisors is, this is great, but I don't have time for this. And so what we've built through the platform is a really easy way to add your client, initiate analysis, boom, your client gets an automated email. You didn't even have to type a thing. You didn't have to introduce us over email. You didn't have to call your client or anything like that. We've just made the workflow really easy. Similarly, on the client side, the advisor doesn't want to inconvenience the client in filling out like a long form or having to print something out. Things like that are not, I should say, enjoyable exercises. Everyone in the healthcare system is formed to death, meaning everywhere you go, you've got to fill out a brand new form with all your information, right? So we've tried to make that experience as enjoyable as possible. We even have confetti that falls from the sky on our platform when you submit all of your information, because we recognize how big of an undertaking, that might have been, and it's not the most enjoyable thing. And throughout the product, we're saying why we need this information, why this is important, so that it encourages the client to continue forward. So that's the really big piece from the platform perspective. For the advisor is workflow and client experience. From the business standpoint, it's scalability. The broker model, people would argue this, it may or may not scale. There's a lot of small business brokers today. You can only serve a certain percentage of the market. You can only represent certain plans. Some plans may not pay you, so you might not choose to offer those plans. It's just a completely different model. So we truly do want to work with financial advisors across the country. If we want to work with broker dealers, custodians, if we want to even work with banks one day, or even robo-advisors, that scalability piece is really, really important. And although in healthcare, the human component is really important, we do deliver that in ways that we find are a bit more scalable. You can book a call with our team directly through the platform. You can message our team through our messaging system through the platform as well. So those are things that do give those clients and advisors a little bit more hand-holding if they need it. And then the third piece of it is just security and compliance. One of the topics that actually makes me cry too, because it's health information, it's financial information. So a lot of that can't be disclosed over email. So we have to build a platform.
Yeah, that's so important. I think it's interesting. You say, I know you guys are focused on, financial advisors. That's where it's kind of migrated to this point, but really you guys are a service to anybody that is caring about whether a client or a loved one's health insurance. For all these questions are out there, rather than Googling it, having someone, guide them through the process. It's really unique how you're doing it. I think you guys can find even a greater market as you go on and as you scale and as you build this, for any one of those that are just even do-it-yourselfers looking for a different way. It always gets to a point where they need a little bit of help. And I love the fact, you try to make it as simple as possible, because it's a simple workflow. It's a simple process that works. It's a simple advice that clients follow, right? I think you're really nailing it with that. So Christine, you stand, a couple years into the process right now. If you could go back and, when you started this with Caribou, or even, before that, and kind of, look at yourself and say, hey, listen, if I knew this one thing, this one aspect, whether I spent a lot of time on it and I didn't need to, or whatever it might be, a lesson learned that you wish you can go back and tell yourself at the beginning of this process to save you time, energy, money, or all the above, what might be that one little nugget that you would tell yourself?
Oh, there's so many things. Every stage of the business, I would tell myself, and I still do, this is definitely the hardest part. When we were just two people, my co-founder and I was like, oh, it's going to get so much easier once we have money. Then we had money and I was like, oh, it's going to be so great. This is really hard. Now I have a budget. Now I have investors to satisfy, but it's going to get so much easier once I hire people. Then you hire people and you're like, oh my goodness, I've got all these people problems. I need training and onboarding. This is going to get so much easier once I have managers to those people. Then you hire managers. It just keeps going and it keeps going. So I think that one thing I would have said back to myself was, enjoy some of those moments, because it keeps getting harder and harder and harder every stage that you get to. There are some things that, I wish that I used to do that I wish I could still do, but now I've had to remove myself. A lot of the work that I do today is the work that nobody wants to do, which isn't as enjoyable. Sometimes I don't get as much customer interface as I would like, but that's just the way that it goes sometimes in running and starting a company, especially as you grow and scale. But I think one of the most important lessons learned, and I was recently introduced to this mental model on a podcast from actually a poker player, which was really interesting, which was the mental model of a monkey juggling on a pedestal. And it probably sounds super crazy, so let me explain it really quickly, which is, if you were tasked to train a monkey to juggle on a pedestal in the middle of a town square, don't build the pedestal first. You can build the pedestal in multiple ways. You could just have a box. You could go to IKEA and build a pedestal. You could use a crate. But once you start building the pedestal, instead of focusing on training the monkey to juggle, which is the really, really hard thing to do, it starts to give you the sense of false progress. So you end up being super committed to this thing, even though you might have realized, had you just focused on the monkey first, this isn't going to happen after 2 to 3 weeks. But if you've built that pedestal, maybe that took you, a few days, you've already started to commit, you've made some progress, and now you're down this path that you have a connection to, and it's harder to peel away from it. It's harder to quit. So I think that what that really taught me was just focus on the hard things first, whether that's related to product, whether it's related to people management, like address that monkey trying to juggle and solve for that first in the macro of your business or in the micro small projects. Because if you can't crack that, then that thing as a whole can't work. And so there was lots of times where we spent a lot of time trying to make something work that clearly wasn't working well. And maybe it was a month, 2 months of time. And then we pivoted, which is okay. I think a lot of companies can end up spending a lot more time in those types of modes when they're not focusing on like the core problem that they're trying to solve. So that's really what we are focused on this year. There's this big component of our technology that is definitely the hardest problem in front of us. And so we're all rallied around that and excited to crack it this year.
I love it. That is such great advice, that there is no easy button in this. There is no set it and forget it. Focus on teaching the monkey to juggle, right? Don't focus on getting a glass of water. Don't focus on, what other, unimportant thing that's out there. If you're avoiding it, if you don't want to do it, and if it's feeling like you can't get around to it, that's exactly where you should go to. You should run towards that, right? Because when you tackle that, then building the pedestal and everything else is much easier. So I love that. We're just all a bunch of juggling monkeys, Christine. That's how it is. I couldn't agree more. So listen, I really, really appreciate your time today. I think this has been great. If you want to, I am going to put information about you and your company and your contact information in the show notes and everything, so people can reach out to you if they want to learn more about Caribou. But I hope, for those that have listened and gotten to the end of this episode, right, and they're thinking about doing it for yourself, listen, focus on that juggling monkey. I love it. That's one of my favorite phrases so far. So I really appreciate your time, Christine.
Of course. Thanks so much for letting me share my story. And I have one quick question for you.
Yeah.
Which shark would you have taken money from if you could go back in time?
If we could go back in time and we could do it all over together, I would have tried to be more strategic to take in from Mark Cuban. And I'm a big fan of his work right now in the pharmaceutical space, as I'm sure you might imagine. Yeah, he's just an open, straightforward, honest guy. He's transparent. A lot of the other ones are playing games with you. He seemed very trustworthy. Damon John seemed very trustworthy. If we can go back and be strategic on it, I would have tried harder to get his business.
That's good. That's great. I love that show, as I'm sure you might imagine, when I was considering ditching the career in medicine. So
Oh
I know.
yeah, yeah, right. Exactly. Not nearly as fun, right? All seeing all those patients every day as being on national TV.
Yeah. Well, thanks for having me, Steve. This was lots of fun.
Maybe we'll take it from here, Christine, if we can, our monkey juggling idea. Maybe that's the next Shark Tank idea.
Maybe it is. Maybe we'll pitch together.
Yeah. All right.
Yeah. All right.
Thanks.
Thanks.